Medical contributor Dr. Ryan Stanton is with us again in studio.
This time, Dr. Stanton, he's focusing on the flu and how cases are rising here in the Commonwealth.
Yeah, it's all across the country. This is our tidal wave of medicine right now, is the flu cases, and most of you, or many of you at home, have already experienced it. I experienced it over Christmas. There is a ton of it out there right now, so let's dive into the numbers that we're seeing. And right now, what we're seeing across the country, this map completely changed versus last week. We were not in this high spread rate. And you look at Tennessee, thank you Tennessee and the South are really shooting us a bunch of flu up here because they've been very high for quite a while. We were holding off a little bit, but the numbers have gotten much worse. And interestingly, looking at this graph versus what we've seen the last few years in terms of the lines that we're going to see, we are already seeing this number looks a lot like what we saw last year with regard to the rise in the flu cases. But honestly, is much higher than it's been in years past for what we've already seen. So what we're expecting is the timing to be very similar to what we've seen in the flu in the past, but potentially even longer. And that's what this graph right here is showing. The red line with the dot way up there near the top, almost coming off the screen, is our year thus far. And this roller coaster is still going up the hill. It is not coming back down yet. You see some of the past years, we had the double bump a couple of years ago. I think this year we're going to have a very strong bump right now, and then we're going to see hopefully trailing off a little bit earlier. I don't want to deal with it. The problem we see with this is that when we have these high bumps like this, it's the healthcare system, the volume, the hospital beds can't take those. We actually have significant increase in the number of admissions that we're seeing, and we're just now starting to see that significant increase in deaths. These are our admissions right now. We're starting to see those numbers trend really high. This is mainly in children and the elderly, which is typical for the flu. This is the H3N2 that we're seeing right now. It is not well covered by the vaccination, and unfortunately, we've heard over the last couple of weeks pediatric deaths starting to mount on that, and that's what we're seeing here. And this graph is very early, but you'll see we've had a steady increase. That first little bump on there is 2020, or actually that's 2021, 2022, where we started to see flu come back after the initial COVID, and we've seen that peak steadily get higher, not only because of the variants that we're seeing, but also the fact that fewer people are getting their vaccinations, unfortunately.
I was just going to ask you, is this an indictment on the effectiveness of the flu vaccine or the number of people doing it? You just answered it.
It's both, because the double-stranded RNA virus of the flu means that it can change. So H3N2 is not different. That is our common one. But this is a different version of that one with 4 major changes to the virus that allow it to maybe sidestep the vaccine a little bit more. The challenge there is that we're going to see a transition to some of the traditional H1N1 as well as the flu type B, and those are well protected. So now we're going to see the second wave is likely going to be ones that the vaccine protects against much higher, and we'll see those numbers ramp up for those that did not get vaccinated.
You think people should start wearing masks more?
I think it's a potential in certain situations. I think the most important thing is that if you're sick, stay home, stay away from people that are higher risk, especially those with young children or the elderly. If you're going to be out and about and concerned or you're higher risk, a mask is not a bad idea at all. I know with the travels I've done in the last couple of weeks, I'm seeing a lot more masks out there.
What do they say? Wash your hands for as long as the ABCs?
ABCs, at least 15 good seconds of washing those hands, washing those surfaces, masks if necessary, especially in the workplace, keeping that workplace clean.
All right, Dr. Stan, thanks so much, and we'll be right back with more news at the top of the hour.
You're watching Fox 56 News, our home, your news.